Hi, I'm Dr. Ravi Yadava, owner and operator of Performance Rehabilitation and Regeneration, and I welcome you to episode 3 of Ask Dr. Y. Spiker, what's our first question?
I'm getting numbness in my fingers whenever I pick up something heavy. What does this mean?
Numbness in the fingers can mean a couple of different things, but more often than not, if you're starting to develop numbness in your fingers and also notice maybe your grip strength is going down, it could mean you're developing an entrapment neuropathy, like carpal tunnel syndrome. There are other tunnel syndromes that can affect your hand, like cubital tunnel at your elbow. But the way we figure that out is through a nerve study, an electrophysiologic study, and then you'll have an accurate diagnosis and you can figure out an accurate treatment.
I hurt my shoulder 2 years ago trying to catch someone from falling. I'm afraid to get surgery, but I've accepted it's a possibility. I don't have great health insurance. Is there a way for me to know without going to the doctor?
I typically tell people this. If you're not 50% better after an injury in a week, you should start thinking about help. If you're not 50% better in 2 weeks, you need help. In the end, there's no way you're going to garner any kind of information independently. You probably need a basic evaluation, an x-ray to make sure you didn't get any kind of unusual fracture or any other kind of anatomic change that would be problematic. Sometimes people get rotator cuff tears from such situations. Sometimes they get labral tears. It starts with a good physical exam. I cannot stress how important it is to meet someone that does a complete exam and not just gets a picture.
I'm trying to lose weight and I have been training very hard, but I have really bad shin splints. I'm afraid I will fall behind if I don't continue to work out. What should I do?
Mary, you're not the only one that runs in this problem. I think sometimes when all you have is a hammer, the world's a nail. And I think that there is different technique to build strength, endurance, aerobic conditioning, and losing weight besides tearing up your shins. I overwhelmingly see people pushing themselves and running treadmill, elliptical activities with situations like this, and some of them actually end up with fractures. And that takes them out of the game for several weeks. So I would say meet up with a good physiatrist, go over your goals. They'll likely have you work with the therapist and give you technique to move forward. In your situation, I'd say, first of all, do you have access to water? If you do, slam dunk. Start getting into water, do kickboard, and do other activities in the aquatic-based setting which will not traumatize your bone and joints.
There are many types of doctors. How do you know which doctor you should see first?
Ryan, I think it's important. I think if you wanted a new paint job, you'd seek out a body shop that does paint. I think if your engine's broken, you'd seek out the best transmission place. Similarly, if you're hurting, the best place to start, physiatrist. Our skill set is unique and better than any other non-surgical specialist. But if you start with the surgeon, you'll likely end up with a surgery. And their skill set for rehabilitation is not as strong as a physiatrist. So I would say you should start with a physiatrist or a physician or clinician that has an excellent physical exam to figure out what your pain generator is.
I went to the doctor yesterday and he was using a lot of big words. I got confused really fast. I didn't want to seem stupid in front of him, so I just nodded my head. Looking back at it, I think this was probably the wrong idea. How should I approach this?
Shannon, you're not the only person who gets overwhelmed, not just by the situation of being in a doctor's office and the whole white coat syndrome thing. Doctors do tend to think in their head and use words that the average person doesn't understand. Don't be shy. This is your health care. If you don't understand what you're doing, you won't do what you're told to do well. Tell your doctor, with all due respect, that didn't make sense to me. Could you say that in layperson's term? I'm not quite understanding what you're saying. You're your best advocate. And if the doctor doesn't know you're not understanding, they're not mind readers. Tell them it doesn't make sense. Any good doctor will appreciate that and reapproach things.
In this next segment, Dr. Yadava is going to explain a term that is commonly used in the medical field, but might not be fully understood by the public. Today's term is anatomical correction.
Anatomic correction basically means that this is aligned with that and they're connected. You know, you tear your ACL or your anterior cruciate ligament, they can go in there and put a graft in and you get anatomic correction. You got a new graft. You could sit there and have your arthroscopic surgery and shave away the torn meniscus. That's anatomic correction. But anatomic correction doesn't mean you're able to walk without pain or getting back to your rugby activities or your football or baseball activities or gymnastic activities. That's functional restoration. There's so many people I see that continue to have pain. They go to their orthopedic surgeon like, well, it was done perfectly, but then they come to me and their quad mass is depleted, and it makes me wonder, what kind of therapy are you doing? And so functional restoration is about your performance. Anatomic correction is a skeleton, making sure the skeleton is intact. Hey, thank you all for your questions. Thank you for tuning in to episode 3. Look forward for you tuning in to episode 4. Again, if you have any questions, concerns, anything at all you want to share, please use the hashtag AskDrY or fill in the comments below. Look forward to seeing you soon. There is a better way.
Thank you for watching and listening to the Dr. Y Show. If you'd like to get your question featured on the show, we use a podcasting app called Anchor, where you can submit your question via audio. Or what you could do is comment in the comment section of this post. We also accept direct messages. Last thing, please give us a review on your platform of choice. We value your opinion, and this allows us to reach more people. Thank you for listening, and we will catch you in the next episode.